Hello, friends. My name is Eric McRae, and I am the facilitator for the Pine Island Pandemic Task Force. And we just want to communicate with you some things that we've been talking about and discerning regarding the current process of reopening. I want to talk to you just a little bit about who we are. Some of you may not have heard of us before. We are Pine Island COVID-19 Task Force, and we are the founders of the Pine Island Pandemic Community Action Facebook page or group that many of you have joined and read a lot of information. We seek to have some useful information on there and hope to be helpful to our fellow islanders. Our group is made up of nurses and epidemiologists. I'm a pastor. We have a former news anchor, community ministry professionals, school principals, civic leaders, and other concerned residents of Pine Island. We want to talk to you about a concept that's not really been in the news a whole lot, but is really important as we think about how we are going to beat this virus. It's called a reproduction number, and every disease or communicable disease or virus has one. And basically what a reproduction number is the average number of people that, in this case, one person with COVID-19 will infect with no preventative measures. So if we didn't do anything, this is on average how many people would be infected. For the SARS-CoV-2 virus, which is the cause of COVID-19 disease, that number all by itself, the disease all by itself, is 2 to 3 people. That means for every person that gets the disease, they will transmit the virus and the disease to 2 to 3 more people. Through social distancing, hand washing, other protective measures, we have brought that number down to around 1. And so I want to talk to you about just what a significant accomplishment that is, and why we need to keep up the good work that has been done. The reproduction number, when it's greater than 1, the number of new infections is rising. And so, we've heard an awful lot about the curve and trying to flatten that curve. When the curve is going up, the number of people becoming infected, that means the reproduction number is above 1. At 1, the curve would be flat. It would just continue to go on in a straight line, which almost never happens. In fact, almost all mathematical things work that way. There's never just a straight line. But when it's on the way down, when the number of infections are on the way down, that means the reproduction number is less than 1. And that's what we want, because when we get it less than 1, we begin to beat the disease. Social distancing, as I said before, social distancing, hand washing, and disinfectant use have moved the reproduction number from basically above 2 to around 1. And you can see in that graphic kind of the effect of that. When one person only gives it to one other person, then there are a whole lot of other people who would have gotten it but didn't because of the preventative measures. And so that's why we're doing the things like face masks and disinfectant and all the things we've been talking about. Now, if we were to do nothing, and as we think about reopening, and we're in that process right now here in Florida, if we were to do nothing, in other words, just remove all of the precautions, and then that reproduction number goes up to 2 or even above 2, this is what happens. For every one person that gets the disease, over 6 cycles, it's transmitted 6 times, it goes to 127 people. Now, this is assuming young and healthy people who have some sort of a baseline susceptibility to getting to the disease. As we know, there are other high-risk groups where the disease is contracted even more easily and affects people more seriously. So of that 127 people, for every one case of COVID-19. 121 of them will get sick, and we know that not everybody develops symptoms, and so about 5% don't develop symptoms. Of those 127 people, one person statistically would die. It's a little more than one person, but it's rounded down to one. So that's with the reproduction number at 2. If we have, we've brought that number down to 1, this is what it looks like instead. 7 people infected, young and healthy people, as I said. 6 to 7 of them will get sick, because not everyone gets sick. And most probably, no one dies in those 7 people. Although the numbers go up as the number of people that you look at go up, the chance of someone dying actually goes up as well. I think y'all know that. So I want to translate the difference for an entire country, because I think that's where we begin to see how this has made an amazing effect and how we've been able to save lives and keep people from getting sick. On May 16th, these are the numbers we're using, and are from May 16th. Almost 1.9 total cases in the U.S., and that's in less than 3 months, from March until May. There are 1.5, or on May 16th, there were 1.5 million current cases. Almost 300,000 people have recovered from the disease, and almost 90,000 people have died. It's over 90 now. But current U.S. COVID-19 estimated death rate right now is around 1%. Now that's including everybody and a lot of different variables, but it's right around 1% of the people who get the disease will die. So with a reproduction number of 2, that means we're doing nothing if we reopen and just let everything go back to normal, or as if it could. But as we just return to life as if this had never happened. These 1.5 million cases over the course of those 6 degrees, as 6 cycles of transmission, that leads to over 192 million cases and almost 2 million deaths. That's what it was doing absolutely nothing. Now, if we continue to do the good work that we've been doing with a reproduction number of 1, these 1.5 million cases lead to 10.6 million, and that's a lot, and 106,000 deaths, a little more than that. Now, if you compare those 2 scenarios, that's almost 182 million less people getting sick with COVID-19, and almost a little more than 1.8 million less people die. So getting the reproduction number down from 2 to 1 actually saves, upwards of 2 million lives. That's why we feel so strongly about keeping these precautions in case. Now, let's get real about this, and my guess is some of you are thinking that right now. These numbers won't be as bad as that worst case scenario described, because many people and businesses have been and are practicing the preventative measures. They're doing the 6 feet of distance. They're using the masks. They're taking other precautions. They're cleaning well between uses and all those kinds of things. So the terrible 192 million infections, we won't get there because people have been smart and have been doing the thing, doing the preventative measures. The point is that these social distancing measures are saving lives and keeping many people from getting sick. So until we have widespread testing, contact tracing, and vaccines, and we get towards something called herd immunity, what we have right now, the practices and preventative measures that we have right now, are the best tools we have in our toolbox to fight this disease. So to kind of review a little bit, what brings the reproduction number down? Number 1, wearing masks and 6 feet of distance between others in public with no prolonged contact, more than 15 minutes. That's something that many people are doing right now. Frequent hand washing and cleaning often used surfaces. No mass meetings. What And what these mass meetings are is their potential super spreading events that raise the reproduction number way up above 2, even way up above the natural number of the disease itself. So that's why it's so important to not have mass meetings. Safe and effective vaccines, and we know that depending on who you talk to, is 6 to 18 months away. And really, that time period is very optimistic. Widespread contact tracing, it's not currently in place. The Florida Department of Health is beginning to mobilize, and supposedly we will see more and more of that. And we're hopeful that that will be the case. Another thing that brings the reproduction number down is people recovering from the disease. And so good health care and taking care of people. That moves us towards that herd immunity where the disease is effectively controlled. But we're not there yet, and we won't be there for that for a very long time until we have some of these other things that we don't have yet. The things that are highlighted there on the screen are the things that are in place right now. And as we reopen, we just encourage folks to figure out a way to do that, to continue to maintain those concepts and those preventative measures. We acknowledge the very good reasons why our society has to reopen. We know there's widespread unemployment, reaching the levels of the Great Depression. We know businesses are failing. We know there's food insecurity for so many, and we know that there are shortages that are mounting and that will continue to get worse the longer that we stay kind of closed as a society. We know this. As a pastor of a church that is trying to feed people every week, we realize that people are suffering more and more as our community and our society stays closed. And so we want to reopen. But we want to do it smart. We simply advocate finding effective ways to incorporate the social distancing and sanitation practices that have been proven to save lives and keep people safer from sickness into the procedures for reopening. So that's our encouragement to people on the island. We love Pine Island, and we're going to keep working to be helpful to our fellow residents and for the duration of this pandemic crisis. So on behalf of the Pine Island COVID Task Force, we welcome your constructive questions and feedback. We welcome your help in the way that you can offer it. We hope you're safe. We hope you're well. And we hope that you'll continue to be that way. Thank you so much for listening.